Good afternoon. Here we are again. Peace and blessings be upon everybody. We are with the ShuraTV Health Show. My name is Dr. Zachariah. I'm glad that you can come and watch this with us, and hopefully we can get acquainted with some different health topics. Currently, we're just about in the middle of June, and summer started, and we discussed things last time. Being hydrated, it's very important to keep hydrated, specifically amongst there's been a little bit of surge of COVID again. So I'd like you to kind of become cognizant and aware of your surroundings. And with all the graduations and celebrations gone, some people have contracted the virus. Although thankfully it's more mild, it still causes some trouble for some people. So be aware of that and wear your mask in big crowded places that you don't know the people. That's a bit of advice that's kind of important. Furthermore, keep yourself on tap. And if you do, for example, get it, and if you have any type of immunocompromised status, or if you're pregnant, or if you're very elderly, or you're very young, you could ask the ER, the emergency room, to get you the monoclonal antibodies. They still give those, and you have a much quicker recovery with those. And of course, they have the medication for it too. It's the antiviral, and you could take that too. But just keep yourself aware of that, what's going on. Hopefully, you're having a great start of the summer for you. Today, we wanted to discuss a little bit about the issue of cholesterol. Cholesterol in the last 30 to 40 years has been something which has been focused on a lot, and specifically its relation to heart disease and causing cardiovascular events, meaning stroke and heart attack and clots in different parts of the body. It's been attributed to cholesterol. And more and more, we're looking at the papers and the white papers over the years and the progression and see where they're heading to. And there's some interesting studies that I'll talk about later. But, cholesterol is something which is, it's basically fat in the body that we need to a certain extent for certain biochemical reactions in the body to function. And of course, as we always preach, everything in moderation, and the body's like that too. So the amount of cholesterol in the body, we don't want it to be too little or too much. This is the issue. If we can help it. There are cases where people are inherently or genetically predisposed to having high cholesterol levels, and they live with it, and they're on some type of medication for it. And that's fine too. That's, they control it that way. But those are the main considerations with cholesterol. And then of course, the classification of cholesterol itself, you have the HDL and the LDL, which is the lower density and the higher density. And the higher density is the good type, and the LDL is the bad type. So then people look at the ratio of the LDL and the HDL to come up with a meaningful indication of where you're at in terms of your cholesterol levels and your risks for cardiovascular disease or any type of heart attack or stroke or emboli in the body. This is something which is being looked at and has been researched thoroughly in the last 30 to 40 years here in the US as well as in Western Europe. So this is something which is on the minds of people, and it's very common to find a lot of people on cholesterol medications. And, the number one medications that are the go-to medications are the statins, right? Or some type of statin to decrease your cholesterol from the abnormal levels. And that usually translates to, 1 or 2 pills a day. And cardiovascular disease being one of the top three killers in the U.S. in terms of per year deaths. A lot of people are concerned about this, and a lot of people are on the anti-cholesterol medications. The only issue that comes up with those medications at times, in 1 to 3% of the population, is a lot of muscle aching or muscle achiness, or sort of what they call a musculitis, or inflammation of the muscle. Some people are prone to that if they're taking these statins as a side effect. They get that muscle aching, and then, of course, they go back to their physician, and the physician will adjust the dose, or they will put you on another type of class of drugs where you can tolerate it better. That's something that they'll do for you. But getting back to cholesterol, I mean, in the U.S., as it is, it's one of the top three, highest mortality rates per year, cardiovascular disease, and they attribute the cholesterol to the to cardiovascular disease, and a risk for the brain, which is a stroke, for the heart, which is a heart attack, and then in terms of the stomach, the kidneys, and the liver, they have digestive problems and gallstones and metabolic disturbances, as well as in the limbs, peripheral artery disease, which is something that you don't want to get. Some statistics, there's about 71 million people in the U.S., which is almost a third of it, which have some sort of cardiovascular disease. So if that's the case, then of these people, we have the sources of the cholesterol we want to look at. 25% of the cholesterol, a fourth of it, comes from the food you eat, and then the other 3/4 is made by your liver, right? So it's very important to keep that in mind. And then, of course, that translates, even that 25% that comes from food, it translates to a third of the U.S. having adults of the U.S. having high cholesterol. So that's something which is important to keep in mind. So a lot of people are going to be on these medications. It's important, and as a practitioner, or as someone who consumes these medications, it's important for you to know that there's a lot of people that are on these medications. So you have to know that these medications have been researched, and the side effects that they report, it occurs in 1 to 3% or 5%, depending on the type of medication there is, right? So that's something which is important to keep in mind. And the management of that medication, you have to be an advocate for yourself when you go to your primary care doctor or your cardiologist who might have prescribed it to you. So if you do have high cholesterol and you are on these medications, it's very important when you go to that yearly exam to make sure that they get you assessed, and they assess the medication, and they check your cholesterol levels, which they normally do in the yearly exam. But it's important for you to know exactly what the numbers are and how the medications are helping you. There are some people that go and take the medication for 3 to 4 months, and then they check prior to the medication and post medication to see if the medications are really lowering the cholesterol, the HDL. It's very important. The HDL is the good cholesterol. The LDL is what you want to be lowered. The low density lipoprotein, that's the bad cholesterol. And it's always important for them. Now they have markers and assessments in the blood test that can be specific to the LDL levels, and they'll give you a level. So once they give you that, then and you can have a baseline and then test that 3 to 4 months later after being on a cholesterol decreasing drug. So that's important to keep in mind. Of course, ways to decrease cholesterol in terms of your 25% of that intake of food is the source of cholesterol being your food, is to change the type of foods that you eat, obviously, right? This is nothing new. You've heard this before, and that's very important. Of course, you want to have a plate which is more than 50% vegetables and fruits, specifically eating a healthy diet. And when you have your plate twice a day or 3 times a day, make sure that you have some type of vegetables on that plate. That's very important to lowering cholesterol. And then the other thing is, of course, regular exercise, right? Regular exercise, that's very important. And if you regularly exercise 3 times a week and you get your cardio in, people talk about getting my cardio in. Your cardio, the whole purpose of that cardio is to increase the heart rate to a certain extent where you have that good exchange of oxygen and in the blood, and that you're pumping that heart and clearing out the arteries and veins of all that gunk or excess particles that would gather there. That's important to do that, Of course, eating habits. I'm sure this has been drilled into you guys, and the green vegetables are the best that you can do for the anti-cholesterol diet, of course. And then, of course, what you want to do is there are certain types of berries that have been shown to decrease cholesterol levels. There are herbals that you can get at places like these are like food supplements and herbal treatments for cholesterol. You can get at places like Mother's Market and Sprouts and places like this, and they have a specific thing called Cholest Off, or they have a berberine. It's an herb that comes from different types of berries, and this has been shown as well to decrease cholesterol levels after taking it for like 60 days. And there have been many studies on this. And fortunately, the good thing is that these studies indicate that the numbers of cholesterol in terms of the bad cholesterol decrease. So when that happens, that's good for you in terms of your numbers and your data when you go to your doctor. In terms of decreasing vascular events and heart attacks and strokes, there's a little bit of a controversy. There's some functional cardiologists who are people who are medical doctors that have studied this for the last 30 years, and their specialty is cardiology. There are some white papers that have come out that have shown that having cholesterol is not directly correlated to having a stroke or a heart attack. And how do they come to this conclusion? There are papers that, for example, tested, let's say, for example, 100 people, right? They took 50 people and they gave them the cholesterol lowering medications. And they took 50 other people and they just gave them sugar pills. And amongst those 50 people, the incidence of stroke and heart attack were the same. So when they saw this, these are all people with high cholesterol levels, and they did the test on them and they monitored them. They did the study. And at the end of the day, when they did the study, they came back and said, hey, the ones that are taking the medication for cholesterol and the ones that didn't take the medication, they both have the same outcomes. These papers are available, and I can get them to you if you want to read them yourself. Just go in the comments and request them and put your email so we can send them to you. But this is actually good news because a lot of people are not compliant with their cholesterol medications. Their cholesterol might be very high, but they don't take the medication regularly, so their body levels of that fat is high. And there are these studies that indicate that whether they're taking those medications or not, the end result in terms of stroke and heart attack are the same in these two cohorts or these two groups of people. So this is something to be studied further, and a lot of functional cardiologists point this out. Now, if you go to a functional cardiologist and you find one, you can go and they'll tell you this. A lot of them, what they do in terms of their assessment, is this test where they do what they know as a calcium scoring for your heart. They do a study where they see the probability of plaques in the coronary arteries, which are the main arteries that are around the heart, and there's the one that supply the blood to the heart. So those now, a functional cardiologist would tell you that the most important thing in terms of your risk factors for these coronary artery diseases would be genetics, and then your own smoking and drinking, and then your own obesity, which is rampant here in the West, right? In Western countries, obesity is another man-made problem because of the genetically modified foods that we eat that have no nutrition, but they have a lot of fat. So this is the issue, and this is what they'll tell you in terms of that. So they would advocate eating whole foods and making sure that you're not eating processed foods that increase the fat and the processed food in your body, because that leads to the coronary artery disease, according to functional cardiologists. That's something very important, and that's something which is to be looked at and to think about, because if you're if you're being screened by cholesterol studies, and the statins are used for primary prevention, well, they don't work. That's what the functional cardiologist would tell you. It works in decreasing the cholesterol, but the stroke and heart attack have the same rates in those who take that medication and those who don't. So having that cholesterol above 200 normally would be looked at as a disease, but these functional cardiologists look at it as that's part of your genetics, or you're doing something to increase it in terms of your lifestyle: smoking, drinking, obesity, overeating, sedentary lifestyle, not exercising. These are the things that they would attribute it to. So that's what it is. You can't ask for that screening test from your family practice doctor. It's called the coronary calcium scoring. It's called calcium scoring, and they can order that for you, and you get a percentage in the results of. It's just like a screening. Then you get a percentage of what's blocked and what's not, and what the probability is for future blocking of that as well. So that's something that that's to consider, and especially for your heart health. Talk to your cardiologist. Let them know. Let your primary care doctor know. Cholesterol is not the only indicator, and as I've said here, in terms of stroke and heart attack, people that are on statins and people that aren't statins, there's an equal footing there, in terms of vascular events. So this is something to be looked at and further studied. If you have any questions or you want clarifications, feel free to contact us. Again, heart health is very important, and the most important thing is your food that you take, and then exercise. And of course, there are some people that are genetically predisposed to high cholesterol. You can't do anything about that other than just live your life in a healthy way and try to decrease the risk factors. That's what you have to do. That's about all for cholesterol. It's just one factor and one risk factor that is looked at very intensely for heart disease. So that's something to keep in mind and talk to your doctor about that. And if you have any further questions or concerns, please contact us. With that, I'd like to end today's program. Hopefully you have a wonderful week. Take care, and we'll see you next week.